Hi students, I'm not seeing it on my YouTube on YouTube to be able to share the link. I'm gonna try one more time. Still not coming up here. I'm still not getting the YouTube link to send to students. So those of you who are on um, and using WhatsApp web, can you send it to the group, please? Because I'm not getting through here. I know two students for sure that's in this class that I don't see in the other classes would be Karina Ramlakan and Sarah Ramkumar. So special good morning to both of them. I think Kezian is in this class as well. Hi Kezi. I still getting some difficulty here to get the session with. Can someone send it to the class to the WhatsApp group? The link. I'm not getting it. We'll just do one. Oh, someone sent it. Okay, great. Right, so let's go. So we're gonna do one session today. Um, so let's get into it one time. Well, last week we did, I believe we reviewed three lectures last week. We reviewed the first one on public health. We reviewed ICT, and I think we also reviewed how is healthcare funded. So today we're gonna do human resources, primary healthcare. Hopefully we can finish all because it shouldn't take us too long. All right. So if you have any questions, when I finish the review of each one, we can have discussion, or in the middle you can just stop me and we can talk about it. The human resources in healthcare, in human resource development in healthcare organizations. This is in public we look at the employee and patient satisfaction. It's something that can apply to both to private as well, and the healthcare system is about an input of systems, equipment, technology, drugs, human resource, make up your processes, your employees, your patients, and how well your employees are managed, how well your patients are managed, and the outcomes being general well-being and customer satisfaction. So slide number 3 gives a nice little diagram there to show you what your healthcare customers are, internal and external, and the satisfaction of either of them, how it can lead to total organizational success. Because you can appreciate if you're a patient and you go into a hospital and you are seeing the employees of the hospital well taken care of, and the employees of the hospital are motivated and interested in your health, and you get a better health product as well. Health product meaning the overall outcome. You're now going to create a good reputation for that hospital. I remember some years ago, Sandy Grande General Hospital had a relatively good reputation. There were many persons from all different parts of the country would have so much good things to say about Sandy Grande. So likewise, there may be locations and you'd want to have your institution have such a reputation, and that can only happen when you have employees that are satisfied and patients that are satisfied. Okay? So employee satisfaction has to do with um, your direct healthcare staff and your indirect healthcare staff. Patient satisfaction looks at the different areas that patients have to go through, and and how their interactions with the healthcare staff is, and that those things determine their satisfaction. And we know that human resource is the largest cost in any organization, and it's the same thing in public large institutions as well. Human resources should their strategic mission should feed in from the organization's vision and strategic plans. Um, you can look at healthcare as a science or an art. The science part being delivering the high quality healthcare products, and the art of it is being managing the persons who are actually providing the services. So human resources have an important role to play in that. Um, with some of the challenges for healthcare systems, physical infrastructure, governance, human resources, of course, being the most challenging, as you remember from our very first set of lectures in farm admin. Human resource management is fundamental, although, and it can be very critical. It's very critical in ensuring the success of the organization. It's 1 minute there, right? So human capacity, insufficient human capacity is a real issue. Is a real issue in many countries, and I remember us talking about other countries that have more capacity and can now engage in medical diplomacy, and we spoke about Cuba being one of those countries, and the reality is that Trinidad and Tobago, because of the amount of doctors, pharmacists, and veterinary surgeons, as well as dental surgeons, we too can also become involved in medical diplomacy by offering our human resource capital to other countries that are in need, other smaller Caribbean states, or even some of the South American countries that need it. So it can be an opportunity for students like yourself and others that are following and others that were ahead who are getting problems to get employment. The government, through an intergovernment relationship, can afford medical diplomacy so that you guys can be utilized in different countries of the world. Um, Without a motivated, competent, and well distributed and well supported workforce, you can have a real waste or misuse of resources. So, human resources are important in providing, in finding and getting the right environment for students in getting your workers to be using your resources correctly and properly. Just give me 1 minute there, right? Right, dimensions of human resource, healthcare performance, coverage, productivity, technical quality, socio-cultural quality, and organizational stability. Look, the productivity part looks at the ratio of outputs versus inputs, your efficiency of your organization, and technical quality, the extent to which services have positive impact on health status. Some challenges of the of the health sector reform on HR. You have some challenges, some changes in cost reduction, improving performance, improving the equity of access to services. Remind me again, what is the difference between equity and equality? What's the difference between equity and equality? This is an important term for students to know, the difference between equity and equality. Nobody's answering. Karina, equality gets everyone the same. Equity, you get what you need. Good. Equity is giving according to need and equal. Right. Good. Perfect. Perfect. So there are some human resources issues that are looking to improve the equity of access to services. Some workforce imbalances would be mismatching of numbers, shortages versus surpluses. In some fields, you have surpluses. For example, in pharmacists and the field, and as well as the doctors as well, you have surplus in numbers, and shortages would still be. I know that they're saying that we have shortages of nurses. However, I am aware that there are several persons who would have completed their nursing degrees, are still out of work. So that's something that we'll have to confirm. An unequal distribution of the workforce, geographical issues as well, and persons being able to reach certain geographical areas. Right. So essentially, the HR issues in institutional healthcare are similar to the HR issues as we did in pharmacy administration. Um, you always want to look at principles of equity, principles of gender balance, ensuring that um, ensuring that as the human resource department, you are ensuring that the right skills are being put into the areas that have the needs, and you use your data to provide evidence-based applications of your human resource policy. So that's a quick run through of your human resource lecture. We can go on to, if there are any questions, let me know. I want to go on to one time to your lecture on, we did primary healthcare after, not so? After we did human resources, we did primary healthcare. Yes, we did primary healthcare. All right, so primary healthcare. Primary healthcare is definitely uh, a question that's coming in your final exam. Let me just take a look and see here. Yep. I have a question here on primary healthcare in your final exam. So primary healthcare, there's a nice definition. Essential healthcare, and remember some keywords that we spoke about. It must be scientifically sound. It must include um, families, communities. It must talk. It must is about access. One of the key words with primary healthcare is access to healthcare. Primary healthcare is all about providing the better access to healthcare to all persons, especially if it is you're looking at it from a community perspective. Okay, Sarah. Right. And primary healthcare is trying to put the self-reliance on the community that they are taking better control over their own healthcare. So there's some guiding principles: equitable access to healthcare based on needs, and the right to every citizen having a right to healthcare to lead a safe and productive life. Remember, I spoke to everyone. I don't know if it was last week or yes, it may have been last week. The whole purpose, the whole point of healthcare is to get everyone to be back to a level of productivity, to be able to contribute to a country's GDP, or productive in the sense of you may not be working, you may not be employing, you may not be employed, gainfully employed, but you can be retired, but assisting your family members or contributing in some other non-monetary way to the development of society. So that's the purpose of health, and this is where primary healthcare has a real important role. Ensuring that every citizen has access to healthcare so that they can lead a safe and productive life. The role of the state in primary healthcare is to partner with local and international agencies to ensure that there are good programs, there are good policies in place for sustained socio-economic development. I want to emphasize that point. Sustained socio-economic development. You don't want policy creation that is not sustainable. Sustainable means it can support itself. It can eventually support itself. You don't need continuous injection of monies into the system for it to continuously work. So the World Health Organization, PAHO, and several of these other international agencies always work with different countries and their ministries of health to ensure that there are sustainable socio-economic policies that will facilitate good health. And we talk about socio-economic policies. Why do we talk about socio-economic policies? Why is socioeconomic development so important? Can anyone tell me? Why is socioeconomic development important for primary healthcare? That's a good question. I should have asked that for your second in course because nobody seemed to be answering. Why is socioeconomic development important for primary healthcare? Hey Tracy, what's up? To allow healthcare for all. Not the answer I'm looking for, but I understand where you're going. It's part of financing. Sarah, build on that. You all build on what Sarah is saying here to have money. Build on what Sarah is saying. It's part of financing. Yes, sort of, kind of semanticy. Build on what Sarah is saying. And Tracy, yes, your healthcare for all. You're sounding like Ganga signal. Your healthcare for all to have money, right? To have enough money for everyone. Yes. And on how does money play a role? Shakila, help them out here. Who scored well in this exam? Jahil. Jahil. You and Sarah did well in this exam, in the last exam. So maybe you might have all the answers here. Why do we want sustained socioeconomic development? How does it factor in with primary healthcare? Come on. Nobody? The answer, the clues are in the exact word itself. Sustained socio-economic development to promote equity in healthcare to ensure that who needs it gets it. Yes, I understand that, and that's equity, yes. But we're not talking about equity in particular here. We're talking about sustained socio-economic development. To sustain the economy, yes, we want the economy sustained because to meet the needs of the current generation without compromising. That's a fancy answer, Chelsea. That's a fancy answer, but it's not exactly what I'm looking for. To have wealth generated. Yes, we want wealth generated in the community because, yes, yes, wealth can so people can sustain themselves, and when they and all of that is because of. I'll have to give you the answer. Social determinants of health. The social determinants of health are, and we're going to come to that later on in the lecture. Um, the role of the state is to develop health resources. Now, let's go straight to it. Social determinants of health. Housing. You need money for housing. Families need money to pay for their housing. Overcrowding. If you don't have enough money to pay for housing, you're going to end up in an overcrowded situation. Sanitation. If you don't have money from sustained socioeconomic development, your place is not going to be well kept, and having not having a well kept place can lead to disease. Transit mode. You have no money, so you have to walk to work. You have no money, so you have to hustle ride, and you could get robbed or murdered, or be sold for the human trafficking trade if it is you have no money and you hustle and ride. Occupational hazards, because you can't afford to be in a position to have a good decent job. You might have to work in a dangerous job. Environmental hazards, again, you have no money, you have to live with in a toxic, in a chemically polluted environment. So having sustained socioeconomic development affects so much things in the social determinants of health. I hope everybody is understanding and appreciating that. Shakila, so people of lower socioeconomic backgrounds have more susceptible to diseases. Yes, to certain types of diseases, infectious diseases, and skin disorders, breathing issues, certain types of illnesses, right? And that's because your lower socioeconomic background does not afford you to have better access to healthcare. Remember, access is not physically going. Access could be uh, being able to understand what healthcare is about, and being able to understand how you can take control of your healthcare as well. So the answer to that is yes, Shakila. That's why public health is so important. That's right. That's why public health is so important. So the structure that's needed for primary healthcare to develop health resources, manpower, facilities, equipment, supplies, to organize, arrange those health resources, to arrange it, to create health insurance, health authorities, etc., to deliver those healthcare services through primary, secondary, tertiary, and we all know what primary, secondary, and tertiary are. Primary, secondary, and tertiary health services. You hope you all know what those are. Does anyone not know what primary, secondary, and tertiary health services are? Let me know. Economic support through public financing, foreign aid from PAHO, foreign aid from WHO, foreign aid from all these different banks. I saw I saw some articles that were saying that many countries got funding for COVID-19 in some large amounts, so that was good. Management through strong leadership. policy formation, regulation, and monitoring and evaluation. So that is structure that is needed for primary healthcare to survive, primary healthcare to be achieved. We just spoke about the social determinants of health. Globalization and other socio-political factors do come into play. We talk about the immigration issue, the crisis in Venezuela amongst and other countries that are causing migration of persons into other countries that are safer. All of those are social determinants of health, and they are barriers. They create barriers. Income is a barrier. You don't have money to buy medication. You don't have money to access healthcare. You don't have money to travel to get to healthcare. Social cohesion, food availability, gender imbalances, living, employment, working conditions. All of these are real barriers to getting into adopting healthy behaviors. But the challenges and the limitations for primary healthcare would be your debt. If it is the country has revenue shortfalls, as what most countries are having right now, your debt, your foreign and local debt, and of course the big thing, political will, the political will to shift spending priority into the different areas that can now affect the social determinants of health. You need to have political will to address many of the factors of the social determinants of health. So those are your challenges and limitations, and you also have human resource challenges, public policy challenges, effects of urbanization and unplanned, unplanned development. Those things do affect um, the execution or the implementation, sorry, of primary healthcare. Lifestyle and cultural changes I spoke about when we did this in the first lecture. Glorification of lawlessness, fast food. Everything is about a lime in Trinidad and Tobago and in the Caribbean. Patients not playing a critical role in self-monitoring. In some societies, early sexual initiation, unprotected intercourse, teenage pregnancy, HIV, all of these are real issues that are affecting the impact of mortality, of the mortality profile in the Caribbean. So these are some real issues and some real challenges that can affect the implementation of primary health care. So any questions on primary health care? All right, so next we're going to move to, I think the last one we did was self-management. So now we're going to move to quality improvement in healthcare. So quality improvement in healthcare. Quality is about avoiding errors, overuse of service, underuse of service, communication issues. Quality can solve this, and we can use tools such as quality assurance, total quality management, continuous quality improvement, and there are different areas, different industries. They look at certain things on quality. The airline industry being on time, being low cost, healthcare services, correct diagnosis, lower wait time. So quality is a tool that can be used to ensure that a high standard or a confirmation to a particular standard is being met. It's very important, especially in public healthcare settings, as well as private healthcare settings in terms of accreditation. So because it can now add to the reputation and to the reputation of the organization of the ability to have certain specifications being met. And we talk about ISO, the International Standards Organization. There are some of the earlier gurus of quality, Crosby, Duran, Deming, all of those persons spoke about quality and what quality meant to them. And we can use quality in today's pandemic to look at the we've already had mention of quality with respect to your hand sanitizers. There's a quality issue with respect to face masks and how these face masks are being used and how they are being made. So quality can now be applied, and you can use quality assurance, you can use quality control, can be applied to certain things, to many aspects of healthcare and many relevant aspects of healthcare in this current pandemic, to ensure that specifications are being met and products are actually being used and achieving the function of the product. So quality has an important role here in ensuring that your product is good. And as you can see on slide number 12, the first job we have to do is turn out quality merchandise that consumers will buy and keep on buying. If we produce it efficiently and economy, we will earn a profit. And that's a very good, important statement. And it, as I said, it has been applied to our hand sanitizers, our sanitizing equipment during this pandemic, and can certainly be applied to our PPE as well, our mask wearing, our gowns, etc., our face shields. How useful is a face shield? How does that affect your chance of catching coronavirus versus wearing a mask? What quality is the mask made of? What is the highest standards of mask that should be used? And who is measuring it? Who's checking on all of these? So this is the whole role of quality in healthcare, especially in a public sector setting, especially in institutional setting. You have a gradual transition from statistical quality control to quality assurance to quality management. But there are rules still for statistical quality control. There are rules, especially now, for quality assurance, with respect to some of the things that I just mentioned. So quality improvement differs to quality assurance a little bit, and you can see the differences there when you compare them in slide number 19. And Deming had 14 principles. He looked at quality from a 14 principles perspective. And then there is the plan, do, check, act cycle. The plan, do, check, act cycle is from Mr. Edward Deming, who modified it later on, who it was later modified to the DMAIC process: define, measure, analyze, improve, control. And these are tools, management tools that are used when organizations are implementing certain things, when they are introducing certain changes to their organization. They can use it to plan for the change, implement the change, check and see how well the change has been working, act on those adjustments when needed, and then plan again. So you can use it for rolling out of new services, rolling out of new equipment. The plan, do, check, act cycle is used for that purpose. All right, so that's quality lecture. Any questions so far? Let me know if you have any questions. We're going to go straight on to the last presentation, which is self-care management support. And for this, the summary for this is very simple. You can take a look at slide number 2, where we are trying to get to improved outcomes by utilizing your community and your healthcare system, that both of them have resources that leads to an interaction between an informed active patient and a prepared proactive practice team that now have productive interactions to get improved outcomes and better self-care management. And we can go down, you can see here on slide number 7, You're comparing patient education versus self-care management support. Let me see if there are any questions. No questions. Good. You'll probably like the speed of going so you can finish class early. Um, so patient education versus self-care management support. And we're going straight to slide number 14, where self-care management is about the 5 A's: assessing, advising, agreeing, assisting, and arranging, all helping that patient develop their personal action plan. All of them may have measurables attached to it, so that because plans and goals and objectives should have measurables in it that can help persons assess and determine their progress. So important slides in this would be slide number 14 and taking a look at slide number 7 and slide number 2. So healthcare management support is us as healthcare practitioners. What do we do? What are we doing? What are we as healthcare practitioners doing for our patients? In a nutshell. In a nutshell, self-care management support, what are we doing for our patients? Jahil, I feel you know the answer. Karishma, helping them take control of their health. Yes, and that's what's the term? Let's use a fancy management term now. Let's get a fancy. Samantha, see, yes, empowering. So we are engaging in utilizing our knowledge, our skills, and working with our patients in providing that enabling environment for they to become empowered and take self care, to become self-directing, to assist in providing care. Yes, Karina, that's what our role is in self-care management. So, ladies and gents, that is the end of our review. That is the end of our teaching. The next time we meet, I will be meeting to discuss your maybe not your lit review, but your second in-course assessment, because we get lit review as well too. So we may have 2 more sessions to discuss those things before you go into final exams. So it has been a pleasure teaching you the material. I hope you would have grasped all the concepts, and we have 2 more sessions again for us to meet or more. We can meet. We can have more sessions if needed because there's more time for us to discuss anything that might be an issue. As I've said, I've set your final exam. Your final exam has been improved. I am urging you all to be critically think and analyze your thought, and apply it back to your lectures. Each of them are based on different. Um, each of them are based on the different lectures. So look through your lectures and use your and think through your 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 answers um, before actually putting them down. So if there are no further questions for today, we're going to end today's session now. And Jahil, thank you. Yes, Jahil, you do well in this. You do well in your first sim course. I'm looking forward to reading your other answers. Right? Again, help each other. Jahil could probably help you all who didn't do so well in your first sim course, and he could show you his perspective. And likewise, you all could show him for community and share your information. Any tips to the review? Or yes, Tracy. Yes, I know you always have some good fun. And lit review is supposed to be posted. I think lit review is supposed to be posted Wednesday night. So I hope that I do get it posted on time and not have a repeat of what happened today with Farm Admin. Um, I am happy that you enjoyed all the classes, Samantha C and Tracy and Karina. I have to be tough because I can't give away the degree. Remember, UWI is ranked number 4. What is it within the top 4% in the world? So we have to be, we have to make you really work for your degree and deserve your degree. So um, the intention was always to ensure that the material is done and you all understand it, and learning is a enjoyable thing and to stimulate your thoughts. So all the best with your lit review and your second in course and your final exam. So I will see you all so long. I will message on the group and we'll confirm when we having those um, sessions to discuss lit review and your second in course. All right, Kai. Yes, Kai. Karina, Samantha, Sarah, Tracy, Jahil, whole gang, Dylan, everyone. All right, Marie, I ain't here for the morning, Marie. Kazian as well. So see you all. Take care. Bye bye. Bye.